Good afternoon to all the viewers. My name is Cătălin Dogar and I will be your host for this week's episode of our university's Academica talk show. We have the honor to have amongst us a very active person in our campus, and yet many faculty members find themselves asking, who is Professor William Au? Hello, Professor, and thank you for accepting our invitation.
Well, thank you for inviting me, Cătălin. I look forward to the interview.
To get us started, we will discuss a little bit about who is William Au. So, Professor, tell us about yourself.
I was born in Hong Kong and went to school there until I was 19 years old. And after that, I went to United States for university and then went on all the way to obtain my doctoral degree at the University of Cincinnati in Ohio. And after that, I worked in Texas for many years until I became a distinguished professor in the year 1991. And so when I was in Hong Kong, it was a British colony with about 5 million people. It was a really great time where we will have a modern lifestyle and a big family. But when I finished high school, I wanted to go to university. And there was only one University of Hong Kong that we all wanted to go to. And of course, many of us did not get to go into that one because 5 million people, one university. So I decided to go elsewhere, and we all wanted to go to America at that time. So I applied and went to the United States. So I've been there since then, and then I also work in different places lately.
So you were 19 when you decided to go to America?
That's right. I went to University of North Carolina when I was 19 years old.
When you were 19 years old. Mm-hmm. Our career shapes our future. You finished your first educational step in 1972 in the biology field, and in 1991 you were already a professor. But tell us a little bit more about this endeavor. How can somebody from Hong Kong get to the, like for some people, the end of their career, to be a professor? That's like a very important step. How much work did you put into this?
Well, it's a very important question. So I try to briefly describe what happened to me. I think it started out, the most important is that my family. My father was an engineer, worked on a ship, and he would only come home one weekend per month because the ship would go around Malaysia or Japan. And so my mother was the one who raised the children. Interestingly, my mother never had an education, but she and my father recognized education is very, very important. So instill in our mind that we have to pursue education as much as we could. And so I never forgot that mission. So even when I finished high school in Hong Kong, I went to university in North Carolina and went on all the way to doctoral degree in Cincinnati. So in order to pursue the goal to get the maximum education requested by my parents, I have to work hard and overcome obstacles. So I went to the United States. I was all by myself. And so I learned how to solve problems. I learned how to avoid making mistakes and to work very efficiently. So one step at a time, I got promotion, got the job, and so on. And I gained experience. I become better and better and better, and to become a professor and become successful in my career. And I would say one thing is that I never shy away from difficulty. When I have a difficult task, I'll evaluate it carefully and see, well, how can I tackle the task and overcome the problem? If I cannot do it by myself, I'll get collaborator to help me. But there are tasks that I don't want to do. then I would ignore them. So I set priority of what I wanted to do and have been doing well ever since.
Education is very important, as you said, but to get education, you need to research things so that you have what to educate the people about.
Yes.
So what do you say, would you say that your favorite research field is?
Yeah. Mm-hmm. Well, education is a foundation for us to get the knowledge and then to obtain skill and to combine the knowledge and skill together to solve problems. And in my field, it's to solve a health-related problem. So in terms of research, so I have always worked in the field of genetics and population health. So genetic is what we inherit is in our DNA, and the model behind us, if you can see on TV, is the model for DNA, the double helix DNA, is the very foundation of the gene in our inheritance. So I studied DNA to understand what are the function of the gene in the DNA, and if they are abnormal, what happened to us. For example, if there are gene abnormality in mutation, then it can lead to development of cancer. So I studied genetics to understand what are the causes for disease, so we can have a better way to prevent the disease, and also to know how the disease develop, where way to intervene to disrupt the process, to have prevention and better therapy also.
Yeah. So basically is into understanding risk factors and their correlation with the disease. So I've always been hearing about risk factors and disease and how they're interlinked, but you know the know-it-alls that always say that I have a friend that's been smoking for 40 years with 2 packs of cigarettes per day, and he's 80 years old and he's healthy as a horse.
Yeah.
How would you tell those people that that's not really the true argument?
Now, that is a very important question. That's precisely what I've been working on in my career to make it better in evaluation of risk and then to better prevention of disease. So I mentioned about DNA. We inherit the gene that allow us to function normally, but we have variation of the gene, so that each one of us are different from each other. Okay, the gene would provide function for what we do, so there are variation that make us function differently. For example, the way we metabolize chemical, the way we repair DNA damage, and so on. So that's the genetic part. Then there's also the environmental part. What we do in our life, they will affect the gene and change our risk for disease. So, well, Cătălin, you mentioned about cigarette smoking. That's what the environmental factor. So let's say, for example, we're lucky, or one person is very lucky to have a very good gene that repair DNA damage very well. So if that person smoke, they have the good gene for that person, repair the damage from smoking. So that person may live for a long time without the disease. But there may be another person who is very unlucky, the DNA repair function a little bit less. It's not abnormal, but less than others. If this person smoke, then his risk for developing cancer is much higher. So in my research, I'm looking at how the environmental factor and genetic factor interact to cause some people to have high risk for development of cancer or disease, while some other are resistant to it, like what you mentioned. Some smokers live for a long time without any smoking-related health problem. So the research will allow us to make what we call precision risk assessment. Instead of saying that smoking is bad, you have high risk of development of lung cancer, we would be able to say your risk for lung cancer is 80% or 90% or 10%. So that's what I would like to get into. But it's still, research is still going
Work in
on,
progress.
which allow us to do that.
You've researched a lot. I've seen your bio, I've seen your resume. It's a very impressive one. At an international level, is there a continent where you haven't researched something?
Oh, that's very interesting. Yeah. Well, we have the American continent, the African continent, European, Asia, and so on. Well, I have involved with people in every continent and most countries around the world, maybe exception of Antarctica. I haven't done any research in Antarctica yet.
There's always time. There's always time for everything.
Yeah, but you see, why do I have so much connection around the world? First of all, I publish a lot of paper. People read about the paper, interact with me, and importantly, I have organized 8 international conferences around the world. With my expertise, for example, I have organized international meetings in Egypt, Brazil, Thailand, Czech Republic, Romania, China, and people from around the world come to my conference and then get to interact with me and also develop collaboration with me, so that I really have a lot of connection around the world.
Yeah, I saw that you all have a connection with the royal family of Thailand, for example.
Oh, well, that is very interesting. Yes,
That's an interesting fact.
That is fascinating. It's not common around.
You're a very modest
among
person.
scientists. Yeah.
You're a very modest person. You say, some research projects there, like some conferences, we meet, we talk, we get interconnected, but this is a particularity that's very interesting.
Well, the princess of Thailand is a very sophisticated and talented individual. She is the number 4 child of the late king of Thailand, but she went on to get a doctoral degree on her own, when the princess does not need to get a doctoral degree. Her life is all taken care of. But anyhow, she got a doctoral degree and very interested in population health and cancer prevention. So she read about my work and contacted me about 20 years ago about collaboration and so on. It's really interesting. So I invited the princess to my international conferences, and she invited me to go to Thailand for her meeting. And so we have been friends for about 20 years, and we met each other at least once a year in different meetings. And so to let you know, her official title is Her Royal Highness Professor Dr. Princess Chulabong of Thailand. So it takes a lot to learn, but that is the way she is addressed officially.
Yeah, it's very interesting that you ended up there by writing papers, organizing conferences. So that may be an advice for people that would like to be in your shoes right now.
Precisely. Whatever we do in our life, if we become an expert, we do very well what we do, opportunity open up. People want to work with you because you're successful. You have a lot you can offer. And of course, you work with them, both of them become better. It's a win-win situation.
If you could name 5 projects that you are most proud of, what would these projects be? Like a top 5 of your research activity.
Well, I just summarize in 2 or 3.
You can say less than 5.
Yeah.
5 is better because it's more. I guess you have like 100 of them, so
many
you don't want to make people like, he didn't mention my research project. That's a problem.
Well, I would say maybe only two topics. One is molecular epidemiology. So a lot of people know about epidemiology, the survey of population for development of cancer, infection, and so on. Molecular epidemiology is a survey of the population looking at gene or genetic abnormality, so that we have better understanding of the mechanism for the disease and be able to make better diagnosis of the problem. And so I did the kind of work with exposed population exposed to environmental toxic substances, like people living around toxic waste area, and also workers who have been exposed to toxic substances that can cause them to have increased risk for cancer. So that molecular epidemiology work has produced a lot of data that are useful for reducing our exposure to toxic substances, so prevention of disease in the population, not only in the United States, but around the world. So the next topic I would like to talk about, and we talked about earlier, is precision medicine. This is an area that is kind of continuation of what I have been doing, but it's a very precise way, that instead of saying that cigarette smoking is bad, can cause cancer, can cause cardiovascular diseases, and so on. And I would like to extend it in a way that we can make individual risk assessment to be able to say, well, if you do this with your gene and environmental condition, your risk for lung cancer is 90%, 70%.
More precise.
Why is it important? Well, because it will motivate people to prevent the disease. Let's say if I smoke,
much healthier population.
I learned I'm 80% risk for lung cancer, I will motivate myself to quit.
Yeah.
Nothing else. So to ban smoking in restaurant and ban smoking in airplane and so, not as effective as I want to quit. So this is what I like to do, where not only smoking, but also other diseases.
Yeah,
so,
maybe give the people ways to quit smoking.
Yeah, that's one way, yes.
Yeah.
Furthermore, this assessment process will allow us to provide precision therapy. So in other words, if something is very wrong with a particular cancer, molecularly, so we can have design a particular drug or therapy to block that process. So there's precision or target directed therapy.
Good thing you are coming to Romania now. So how did you decide to come to Romania? Because we are glad to benefit from your level of expertise.
Well, the benefit is mutual because I enjoy working here. So now the story like this. After I work in the United States, I studied in the United States for more than 40 years and become distinguished professor in the United States. I have already traveled around the world to give lecture. Then I decided that I would enjoy working in different places, a different country, so I would have a better understanding of the culture, their lifestyle, and their scientific problem, because I like to solve problems, work with people to solve problems. So about 10 years ago, China recruited me to work there as a distinguished professor at the Shantou University Medical College. It's the southern part of China. At first, I thought I would work there for about 1 year or 2 years. Well, coming from America, working in China is not an easy decision because China is a communist country. So I don't mean to be bad, but very different political and cultural background. So I thought I would work there for 1 or 2 years, but I ended up working there for 7 years. I enjoyed very much. And I have traveled to Romania to give lecture several times. I get to know about your professor, Professor Minodora Dubranu. And then 2 years ago, she contacted me and said, well, the university opened up a molecular center or advanced research center, would like me to consider coming to work here. And I was excited. I said, wow, being able to work in Europe is something new to me and will be rewarding. And then I get to know your rector, Asafiri, and he was enthusiastic in having me here. So it's a mutual respect and understanding. So I came, and I've been working there for 2 years and really enjoyed it very much. This is a very, very nice country. Beautiful country, wonderful people who work hard and want to do well. So this is what I enjoy doing. So the benefit is mutual.
Does the research center facilitate your needs for research? So
Yes.
is it okay for what you need to do in order to finish your endeavor in this field, like
Yeah.
the fields that you mentioned before?
Well, when I came here, Dr. Minotaur Breno and also the rector have very good idea what they want me to do. So research is just one small part of what I do here. The rector wanted me to utilize my expertise to expand the reputation of the university internationally. So I come back to research later, but so I develop innovative projects that are internationally based, and of course these are approved by the rector before I start doing it. And of course I work with many faculty on campus to make it work, because as a newcomer I did not know the resources, I did not know the custom and legal opportunity, legal matter, and so on. So a lot of the faculty helped me. So, well, for the 2 years, I developed international collaboration with China, Thailand, and Korea.
Do we have student exchanges there, or?
Yes. Yeah.
Different.
4 of our medical students already gone to China for exchange to learn clinical skill. And this year, 1 student will go there, and then 5 professors from China will come here to interact with us. So this is a very active program. And well, among the doctors who come here, one is an interesting topic is to organize a workshop on traditional Chinese medicine and pain management. So my idea with the rector's idea, of course, is to link Chinese traditional medicine with Western medicine for better management of pain. So if we can manage pain better, our quality of life will be better, we'll be much more active at work, will be more active in sport activity, and so that are the international collaboration with 3 countries. And I also organized an international meeting last December here. It's called the first international conference on innovation in population health and personalized medicine. This is the first meeting of this type around the world. So our university is recognized for organizing it. Well, it was successfully organized meeting with speakers from around the world. So it gets so well recognized that there will be follow-up meetings. The next meeting will be in Thailand in the year 2020. After that, will be in Italy. So you can see that and our rector, as I'm very happy about it, because our university will always be remembered as the first university to organize the first conference, and will be participant in future conferences. So this is what our rector would like to do, is to have major impact from our university to the world.
So the result is already that we are organizing it even in 2022. So
yes, in Italy.
Yeah, in Italy. So we already know the 3rd conference where it will be. So it's a good proactive
yeah, that's right.
event.
And I think that the traditional Chinese medicine and pain management will be another major activity for here to improve health, linking Eastern and Western medicine together. So it's a very innovative way to do that. And we hope that will be a sustainable activity into a bilateral pain management clinic, China and Romania. We'll expand to Europe also.
Yes, with your expertise in education, now you came here working for the University of Medicine and Pharmacy of Târgu, Mureș. Now we saw the future like it's today, and we are a merged university with a technical and a general science university. And now we are the University of Medicine and Science, of Medicine, Pharmacy, Science and Technology. Now we need to be better at this, because there is no doctor without in this century, doctor without equipment that is made by engineers, for example. So it needs to be just like an arranged marriage and work together. But do you have any projects that will make this idea more understandable and to make this idea actually people? You knowing a lot of people, you are able to talk to them at all their fields and bring them together so that they can discuss in a common language their fields and to make like the world a better place.
Yes.
Do you have any projects like this one?
Well, there's several components I want to address your question. First of all, as a university, education is one of the major functions. Yeah? And we have talented people. And education, we're talking about training and education students for the future. So we have to really look far ahead. What do we want to educate students today so they can be better doctor and better professor 4 years later? So we have to be really far ahead in our teaching, in our curriculum, that they will be able to be leader in the future. And education, like teaching, many people may not be aware of, is also a science and research project, because we always have to find new way to educate students, to motivate them to become lifelong learner, to become better and better. So yeah, in education, we conduct research to how can we do better. And already some of them are well known to us. So instead of just didactic lecture from professor to student, we integrate problem-based learning. We integrate team-based learning. We integrate case-based learning. We engage students to initiate their own interest in learning and for the future. So that is education we need to be doing more. So then the other one, they mentioned about we integrate different universities together, and we, instead of medicine, dentistry, and pharmacy, we have engineer, economists, and so on. So I propose to rector some theory that we need to start a program to integrate them together. So the first project we like to do is called a synergy project. Synergy means we combine together. Together we produce much better result than expected. So the first action of the synergy program is to develop a distinguished faculty seminar series. Well, we have all the faculty to take turn to give seminar that open to the university, open to the public. Because this is the way we learn from each other. What is your expertise? What can we do to work together? Because otherwise, just like we say, who is William Au? Yeah.
Go back to the first question.
Who is William Au? Why is he on campus? So I would be happy to give a lecture to the entire university. This is what I do. These are the opportunity we can work together. So we have engineers to talk, and we have economists to talk, and so on. And this is, would be one. In fact, I have also in the University of the Petromaya, I met a very good, excellent professor in the school, and he is expertise is to develop innovative and entrepreneurial program. So I've been discussing with him to integrate his expertise into this synergy program, and it's we are starting.
Do you feel the enthusiasm of the community?
Yeah.
That's the most important thing. To
Yes.
people to understand that we need to be better at what we do. And me as a doctor, having an engineer with me would be a very important step, or even like somebody from political management or from law. It's very important for the doctors to know what the problems in law in their field are. But it's easier to have a doctor with a lawyer that already met in the university than to meet in a courtroom, right? So I'm glad that things are trying to move in that direction to make things like more actually synergy.
Yes. In fact,
That's
this
the
is
word.
this is what I like working here, because the rector, as I'm theory, is very energetic, very open-minded, and always open for new idea. And I have already found many members here who are consistent with what I would like to do. And so this is coming. And I think that we're working together, the university will be able to leap and bound in gaining more recognition internationally. And well, with that distinguished seminar series, it's not limited to our people in our two universities. We can open up to outside people. Maybe drug company will have people to come and listen and develop joint venture in drug development and therapy protocol. That will be possible.
In the ending of this episode, I would like you to think about some advice that you would give some energetic young fellow that would like to be in your shoes. I've mentioned this at the beginning, but I would like you to give a message to them.
And I just message.
How can they achieve what?
Yeah. Well, I have students in the United States and China and here and around the world, and I'm excited about giving them my advice based on my own experience, and they can see it, and many of them are highly successful as well. So I would say that the young people, they have to have an open mind. They have to be able to set goal, the goal that will challenge them to do better, and don't be shy away from difficulty. Either the difficulty that shape the career and allow them to gain experience in overcoming difficulty and become successful. And if people say, well, some people always say, well, they are trying to do something. They went into a wall, a roadblock, that they cannot move forward. Well, I would say the wall is there to keep the pessimistic people from being successful. The optimistic people and talented people will find way to go over the wall or around the wall to reach the success. So I think that's a good way that they should not shy away from difficulty. They have always, when they set a goal and have a way to solve problem to the goal, they need to solve problem along the way.
I will take that advice into revision. It's already the weekend, so I think I will put that advice to action. And thank you very much for making the time to come here and shed some light on what you do for us, for the world, and for everybody, and what we do for you.
Thank you.
And this concludes our episode. Thank you for watching. See you soon. And Professor, goodbye.
Thank you very much.